Welcome back to Talk of the Town. With me now is Dr. Mathew Epps, MD, Plastic Surgery. That is our new business in Bluffton. We're so happy to see you. Thank you for being here.
Oh, it's a pleasure to be here.
Yeah, so you guys have been open for about 2.5 months, you told me before we started filming, and you have this very unique plastic surgery business in Bluffton. So tell us about it.
Well, we have, not only do we have a full aesthetic plastic surgery practice, but we have a full medical spa, which I'm completely hands-on with. And that makes us unique in the area, as that I am a plastic surgeon with advanced aesthetic training who is also has a degree in medical pharmacology and can manage anything from your skincare to Botox fillers to non-surgical facial rejuvenation to then surgical facial rejuvenation, particularly facelift, eyelids, and aesthetic breast surgery.
So when we talked a little bit before we started filming, and we could probably take the whole time talking about this because you have so many different trainings and fellowships that you've done, but touch a little bit on that and about how that makes you unique in the industry.
Well, in the industry, what little is known regarding plastic surgery other than it's the Wild West right now. And everyone and anybody is getting into the field, especially with our last few years of an economic boom. As far as plastic surgeons, most plastic surgeons spend their time in the operating room. But there's also has to be a distinction between, in plastic surgery, there's several routes you can go. You can be an ENT surgeon and have a one-year fellowship in aesthetics and then be a facial plastic surgeon, or you can be a general plastic surgeon who then goes on to perform aesthetic surgeries as well as reconstructive surgeries. And there's also an additional route, even orthopedists can become plastic surgeries through an additional residency. And so for me, what makes it unique is I am a dual residency trained general surgeon, a trauma surgeon, and then I went into plastic surgery. This is considered the old traditional route where you learn to operate before you learn to be creative with operating. And that's the trick.
Sounds like a good plan to me.
It makes you comfortable in any situation.
Yes.
But on top of it, little is known about something called an aesthetic fellowship or advanced training in plastic surgery. These are usually typically reserved in larger cities for plastic surgeons to try to create a niche or at least explore something that they're very interested in, and then they can focus in on that. Usually one sort of an aesthetic fellowship's enough. They're general aesthetic fellowships where you perform not just procedures like you would as a general plastic surgeon, such as breast reconstruction or skin grafting or facial fracture fixation, but instead to focus highly on surgeries that are rather complex, in which your results are millimeters, not just centimeters, such as facelift, neck lift, brow lift, particularly in eyelid surgery. And so I completed 4 of these in major cities. An additional one, which was also through a society, one plastic surgery society, was also completed in Atlanta at the same time as completing another one. So I technically don't count that one. That would be a 5th.
Well, let's count it. I mean, so clearly you're obviously very well trained and very well versed in what you're doing. And I think something that's also interesting that you shared with me is that when you meet with a client, you're meeting with them between 45 minutes and an hour and a half. This is not like a little 10-minute, let's give you some Botox and you're out the door. Tell us a little bit about the procedure of when somebody comes to see you, how you go about deciding what it is that's best for them.
So one of the things I learned is I was in a facial plastics, I was in 2 fellowships in New York City, a facial plastics and then an aesthetic breast and body fellowship. And when I was there, I was working for 2 different practices. One was well known in Long Island. He's sort of the go-to for aesthetic breast and body surgery, and the other person was very well known in facial plastics. And 2 practices taught me something. And one, you'd see typically 30 or 40 patients a day. You'd operate on 8 different cases a day, and the other one you'd see 10 to 15 patients, an hour-long consult. And between both practices were equally successful. But the patients between one and the other, patients seemed to be happier when they spent more time with the surgeon.
Sure.
And I felt that the surgeon knew these people very well. If a person called, he knew exactly who it was and said, oh yes, I know so-and-so, have them come in. And so I kind of adopted that. When I got to Atlanta for my oculoplastics and facial plastics, another fellowship, I learned this too, is that typically your day was seeing an hour to an hour and a half consult. Part of it starts out with just getting to know you. Who are you and what is it that you want? in a relaxing setting, not just in the white clinical room with the robe on.
Right. I love that. And we're crazy enough, we're out of time because I know we could keep talking all day long. So thank you for being here. And I know we're going to see you again on Talk of the Town so we can get even more details on what you do. And we'll be back in just a moment.
Thank you so much.